Hello, my name's Angela Robertson. I'm a research professor and the Associate Director at the Social Science Research Center. Ta-da! We're off campus. We're in the Cochran Research and Technology Park, which is just north of campus. I have a bachelor's degree in psychology, a master's degree in clinical psychology, and I came to work here at the Social Science Research Center and got my PhD while working here full-time. So my PhD is in sociology with an emphasis on criminology. Before coming to Mississippi State, I worked in community mental health and drug treatment. So I worked for a couple of different community mental health centers, and I ran an adolescent substance use treatment program. It was when I started doing program evaluations, it was real important to me, if we're going to be providing services and particularly using very limited state funding, I wanted to make sure my programs worked, that they were effective. And so that's when I first got interested in doing research. The Social Science Research Center does a lot of things, and as the name implies, we have a collection of professors, faculty, folks that have appointments in departments on campus, and folks like me who work here full time. So as the name implies, social science, we have psychologists, we have sociologists, we have social workers, we have people with degrees in public administration. In the past, we've had economists, historians. We've got people with, as you can see, all kinds of backgrounds. And so what's very unique about the Social Science Research Center is it was set up to be what we call PI for principal investigator. It's PI driven. People like me, the principal investigator, we study what we want to study. The issue is bringing in the money. I love the fact that we take a it's very much, like I said, PI driven, but we also take a team approach here. I couldn't do what I do without grad students, undergraduate students, research associates, and other people here. Right now I've got a team of 4 people working for me. And again, that goes up and down depending on how many projects, how many contracts and grants I have. So I really like that aspect. And so if there was some project that maybe I, wanted to go and get some grant funding for, and I knew that there was somebody else either here or in one of the departments that was interested in that topic that wanted to work with me, we would just, we'd work together as a team. You got an idea, you want to pursue it, go for it. I just got funded from the National Institute of Justice. It's how can we come up with an intake risk needs assessment tool or tools that youth courts can use at intake when a kid first comes in the door to try to help them make decisions about, well, this kid's low risk, let's just divert them away from the system. We don't need to involve them in the system. They probably won't get in trouble again, whether we do anything or not. So that's what that study's about, and that's a 3-year study. I've got 2 projects with the Department of Corrections. These are evaluations. So they got money from the federal government to deliver services to prisoners that have mental health and substance use problems. It's called co-occurring. And it's for people that are going to come out of prison, so it's all about reentry. The idea is if you identify people that have mental health and substance use treatment needs or service needs, and you provide those needs to them while they're in prison, but also when they leave prison, then you can reduce recidivism. I did some research way early on, it seems like forever ago, where we looked at mental health and substance use problems of kids that were involved in the Mississippi system, and did a study and got it published, testified before the Mississippi legislative committee that has to do with juvenile justice, so that now all kids that come into juvenile detention centers, think juvie jails, now have to be screened for mental health and substance use problems. So I'm very proud that my work had some small role in making sure that kids get screened, because first of all, you got to identify problems before you can provide services. I'm also very proud of the work that we've been doing with MASAP. So this is a court mandated, people are ordered by the court to come to our program. They have to complete the program successfully in order to get their license, driver's license, reinstated. From the very beginning, I have used my psychology, clinical psychology background to really look at, can we, first of all, is MASAP effective? I mean, you're ordering people to this program. I want to make sure it's an effective program. So we've been looking at, again, recidivism, but we've also, looked at collecting information directly from participants about what they found helpful and or not. And so we've revised the curriculum a couple of times. So when people come to the first session, we have them complete a questionnaire about their substance use, their alcohol and other drug use. A lot of questions about drinking behavior, the likelihood that this person might actually have a substance use disorder and need treatment. Because MASAP is an intervention, we're not treatment. So that's what this assessment is about. We've also modified that over the years, and so this current version of our assessment includes this recidivism risk scale. It's going to be very limited just to court systems that handle DUI, impaired driving. Would also be probation departments who handle DUI offenses, agencies or individuals who, in Mississippi, they have to be certified to do these assessments. I've been here a long time. I love it. I especially love working here at the Social Science Research Center, being in the technology park. It's beautiful surroundings, lots of wonderful people. That's why I've been sticking around. Have no desire to retire anytime soon. It's just because it's a lot of fun to work here.